Let us move to another very interesting topic called beam hardening. Beam hardening. I want to explain this concept from the absolute very beginning. Look at this image. You can see a linear accelerator at the top producing a treatment beam of radiation. The beam is made up of many tiny packets of energies called photons. Notice the different colors in the beam before it hits the solid black line. Some lines are red and some lines are blue. The red line represents weak photons that have very low energy. The blue line represents strong photons that have very high energy. So basically, treatment is polyenergetic, not monoenergetic. Now look at the thick black horizontal line in the middle of the screen. This black line acts like a physical filter. When the mixed polyenergetic beam tries to pass through this filter, something very interesting happens. The filter easily stops and completely blocks the weak red photons. But the strong blue photons safely pass straight through it. Because all the weak photons are completely removed, the remaining beam we get is much stronger. The overall energy of the beam actually increases. In our clinic, we say this beam has become harder. This simple physical process is exactly what we call beam hardening. It simply means removing the weak radiation to make the final beam much more hard. That means much more penetrating. Understanding this basic concept is absolutely vital. Let us look deeper into this topic of beam hardening and see how exactly this works inside the patient. Let us compare two different types of radiation beams. First, look at the theoretical monoenergetic beam on your left. Now, what does the word monoenergetic actually mean? The word mono simply means one. This means every single photon in this beam carries the exact same amount of energy. If you look closely, you can see all the black waves look exactly identical. But please remember that this perfect ideal beam does not exist in our reality. It is strictly a theoretical concept. We only use this concept to make basic mathematical calculation much easier. Now, look at the true real life scenario of your daily clinical practice. Our clinical linear accelerators actually produce a polyenergetic beam. The word poly simply means many. This means your treatment beam consists of a complete spectrum of many different energies. Once again, this means your treatment beam consists of a complete spectrum of many different energies. Please notice the different colors and sizes of the wavy lines on the right. It is a complex mix of weak low energy photons and strong high energy photons. Some photons have very little power, while others are extremely penetrating. Understanding this simple mix of energies is your very first step today. We must completely understand this mixed reality before we can understand how the beam safely travels through your patient. Now let us imagine placing a thick absorbing material right in the path of this mixed beam. This large black block is a thick absorbing material. As our treatment beam travels through this solid block, a very important physical filtering process begins. To truly understand this, we must look at the strict physics rule. This fundamental rule states that the probability of the photoelectric effect strictly increases as the photon energy decreases. Let me simplify that for you. It simply means that weak radiation is absorbed much more easily than strong radiation. Because of this specific rule, the weak, low energy photons get completely trapped. Look at the red arrows. These red arrows represent the weak photons hitting the absorbing material. They are easily stopped and readily absorbed right inside the block. They simply do not have the physical power to penetrate through to the opposite side. Now see blue arrows. These blue arrows represents our strong high energy photons. Because their energy is so high, the photoelectric effect cannot easily catch them. Therefore, they successfully penetrate the block and travel straight out the other side. This simple image shows exactly how a physical filter works in our daily clinic. It literally eats up the useless weak radiation while allowing the useful strong radiation to safely pass. Now let us see exactly what happens to the remaining beam after this physical filtering process. See this graph. You can see two different curves representing a radiation beam. The dotted red area on the left side strictly represents the weak, low energy photons. As we just saw in our previous slide, the physical filter has completely absorbed and removed these weak photons. Now listen to me very carefully. Because these weak photons are completely gone, something very interesting happens to the remaining beam. Look at the solid blue curve on the right side of the graph. Let us think about this using very simple mathematics. If you permanently remove the weakest members from any group, the overall average power of that group naturally goes up. Therefore, the average energy of our transmitted X-ray beam strictly increases. Because the surviving beam now consists mostly of strong high energy photons, it completely changes its physical character. In our daily clinic, we simply say that the beam has become harder. It has become significantly more penetrating. It can now penetrate much more deeper into the patient's tissue to reach even a deep-seated tumor. This entire physical process of removing weak photons to increase the average beam energy is exactly what we call beam hardening. You must perfectly understand this simple graph because it directly dictates how the treatment beam will behave inside your patient. There is a paradox here with HVL. On the far left side, you can see standard polyenergetic beam. You can clearly see it consists of a complex mix of weak red photons and strong blue photons. This mixed beam now enters our first half value layer. As you already know, this first shielding block successfully attenuates exactly 50% of the beam intensity. But please remember our physics rule about physical filters. The first block will easily absorb and completely stop the weak low energy photons first. Because all the weak red photons are completely removed, please look at the transmitted beam in the middle. This new surviving beam has a much higher average energy. We simply say the beam has become hardened and significantly more penetrating. Now let us reduce this new stronger beam by another 50%. The beam now enters the second half value layer on the right side of your screen. Because the incoming beam is now so much stronger and highly penetrating, this second block cannot be the exact same size as the first one. It strictly requires a much greater thickness to successfully stop these powerful blue photons. This simple visual logic perfectly explains a very famous rule in physics. For any heterogeneous polyenergetic beam, the second HVL is always greater than the first HVL. Once again, for any heterogeneous polyenergetic beam, the second HVL is always greater than the first HVL. Even if you forget the complex mathematics, you must strictly memorize this golden rule. Now let us discuss why this physics concept directly matters for your daily clinical practice. It is all about patient safety and skin sparing. Please look at the red color X-ray photon treatment beam here. This shows what happens if we treat a patient without any filtration. If you do not safely filter out the weak low energy photons, they are of absolutely no clinical use. These weak photons simply cannot reach a deep-seated tumor. Instead, they will be completely absorbed in the patient's superficial skin layer. This would unnecessarily increase the surface dose and cause severe skin toxicity. Now look at the blue color X-ray photon treatment beam. This shows what happens when we use proper filtration. By intentionally placing filters, we selectively absorb those weak photons before they hit the patient. The surviving beam is now much higher and highly penetrating. By intentionally hardening the beam, we achieve vital skin sparing for our patients. This hard beam safely passes through the skin and successfully treats the deep-seated tumor. This brings up a very important historical fact for your exam. In the older ortho voltage era, we used a specific filter called the Thorius filter. This filter was composed of strict layers of tin, copper and aluminium. We intentionally use this exact combination to achieve this precise clinical hardening. Understanding this difference between useful and useless photon makes you a much safer radiation oncologist. Beam hardening is not always a good thing to happen. It can be dangerous too when happens at wrong places. Look at the most serious clinical problem caused by beam hardening. Look at the patient's pelvis here. This patient has a very dense metal hip implant. As we know, heavy metals have a very high atomic number or Z. Because of this high atomic number, metal acts as an extremely strong physical filter. When the polyenergetic beam from the CT scanner hits this implants, an intense filtering process happens. The filter strictly and easily absorbs almost all of the weak low energy photons. Only the very strong high energy photons can successfully penetrate through the heavy metal. This sudden and extreme change in the beam energy creates severe beam hardening artifacts. You can clearly see these severe dark streak artifacts completely ruining the CT images in the middle. These dark streaks are an absolute nightmare for radiation oncologists. So what is the real clinical impact of beam hardening at places we don't want it? First, these artifacts severely impairs your ability to accurately delineate the target volume. You simply cannot see the true tumor boundaries clearly. Second, they introduce major mathematical errors in your treatment planning system. Your system cannot properly calculate the electron density corrections through these massive dark streaks. This strictly means your final dose calculation for the patient could be dangerously low. Do we have any solution for this problem? Now look at the beautiful solution for this problem. Please look carefully at the comparison table clearly shown on your screen. You can successfully bypass this major artifact problem by using mega voltage CT, MVCT. Let us clearly compare the standard kV-CBCT and MV-CBCT line by line. Please look at the middle column for standard kilovoltage CT. Standard CT uses low energy kilovoltage beam. Because the energy is low, the dominant physics interaction is the photoelectric effect. As you already know, the photoelectric effect is highly dependent on the atomic number. So, when the beam hits a dense metal implant, it gets intensely absorbed and creates severe dark streaks. Now look what happens if you take MVCT instead of CBCT. MVCT strictly uses high energy mega voltage photon beams. Because the energy is so high, the dominant physics interaction completely changes to the Compton effect. This brings us to a golden rule. The Compton effect is practically independent of the atomic number. It simply does not care that the metal implant has a very high atomic number. Because it ignores the heavy metal, the radiation safely scatters and passes through without that extreme absorption. Therefore, MVCT effectively minimizes those terrible metallic beam hardening artifacts. It provides a beautifully clear target for your daily patient image guidance. This simple change in physics ensures accurate treatment planning and maximum safety for your patients. We have now reached the end of our discussion for today. Let us quickly summarize the core concept we just learned. We started with the fundamental concept of beam attenuation. We clearly saw how our invisible treatment beam gets weakened as it travels through the patient. This happens strictly through the physical processes of absorption and scattering. Next, we moved to the very practical concept of beam quality. We learned how to mathematically measure the penetrating power of our beam using the half value layer. Please remember that HVL strictly halves the intensity of the beam, but it never halves the energy. Finally, we applied all this logic to understand beam hardening. We saw how dense material acts as strict physical filters. They preferentially eat up and completely remove the weak low energy photons. This leaves us with a surviving stream that is much harder and significantly more penetrating. We also saw how this simple physics rule dictates both vital skin sparing and terrible CT artifacts. Understanding these macroscopic beam behaviors is not just for passing your board exams. It is the absolute foundation for your daily treatment planning and patient safety. In our next lecture, we will zoom in to look at the microscopic physics. We will learn exactly how these individual photons interact with atoms through the photoelectric effect, Compton scatter, and pair production. I hope this session made these fundamental physics topics much easier for you to visualize and understand. Thank you very much for your patience hearing. See you next video. Signing off, Parveen Ahlawat.